Good afternoon, everyone. Welcome to our webinar this afternoon on relaxation and stretching therapies. My name is Gabriele Colasordo. I'm the Manager of Education and Patient Services at Myeloma Canada. Before we start the webinar, I'll just go through a few things as I usually do. Thank you to our sponsors for providing us with educational grants to make this possible. Without them, we wouldn't be able to do this. So thank you to Amgen, Binding Site, BMS, Janssen, and Takeda. So as you've noticed, we're doing a lot more webinars these days, and we have a few more topics coming up in the next few weeks. Our next webinar will be on the 20th of May from 4 to 5 p.m. Eastern Time. It'll be on the role of the role of the drug access navigator and access to medications during the COVID-19 pandemic. So we get some information about that. Our presenter will be Amy Pilon, who's the executive director of ODANO, the Oncology Drug Access Navigators of Ontario, and she also works at a pharmacy. So to register for that event, myeloma.ca, news and events, you click on that, click on educational events, and then webinars, you'll be able to find that and register for it. All of our webinars are recorded. You can access those recordings through YouTube. So if you want to go back and see what we have on YouTube, if this is your first webinar, then go on youtube.com right here, type in Myeloma Canada in the search bar. Our channel should be one of the first that you see pop up. You can click on subscribe. When you click on the subscribe button, this will automatically notify you when you have when Myeloma Canada uploads a new video. That way you can stay up to date with all the latest and greatest. From our website, myeloma.ca, if you click on the resources button here at the top on the tab, this menu will open up. You click on educational videos, and you'll be able to, it'll redirect you to the YouTube channel. So that's just an easier way of getting there. So how do you ask questions? So it'll be a little bit different than other webinars, today's webinar. Usually I ask you to use the questions function on your GoToWebinar panel. For the purposes of this demonstration, which will be very interactive, we ask that you please use the chat function. And so if you type your question, if you click on, in your GoToWebinar software, you have this little gray box here with a little triangle. If you click on the triangle, the chat box will open up, and you can type in your question here. Click on the send button, and we'll be able to answer your questions that way. So without further ado, I'd like to introduce you to Kyla Johnson, who is an occupational therapist at the Segal Cancer Centre at the Jewish General Hospital in Montreal. Kyla, thanks so much for taking the time to join us here today.
My pleasure. Welcome, everyone. As Gabrielle just said, we're going to try our best to make this some sort of interactive experience, despite the fact that we're all stuck behind screens right now. So what I'm going to start, I'll just encourage you to open up that chat box and go ahead and just type your first name and where you're from. I'm curious where people are tuning in from today. So feel free just to introduce yourself in the chat box. I should be able to see your responses popping up if you feel comfortable doing that. And as those come in, just to reintroduce myself, my name is Kyla. I am from Montreal. Sorry guys, I'm just trying to see if I can see some chats. I don't see anything coming in.
Kyla, I see some people are writing in the questions box.
In the questions box, okay.
Yes.
Guys. Let's see. Questions. Show answered questions. Unfortunately, I don't see the questions either.
I will give you access. I think you should be able to see them now.
Yes. Thanks for your patience, everybody. Okay, here we go. Excellent. So we have Sudbury and Vancouver and Edmonton and Ottawa. So this is really nice, guys. Thank you for saying hello. It's fun to know that we're all kind of connecting from across the country. Excellent. Hello from Quebec, Julie. Thank you. So like I said, I'm an occupational therapist. I work at the Jewish General Hospital and primarily in the Cancer Centre. So my role as an occupational therapist is really to be part of the rehabilitation and the support team for the oncology patients. Specifically, I'm working with outpatients, so people who are receiving treatment or who are post-treatment and are working at integrating back into their life. I also work in the palliative care floor at the Jewish. So again, just to keep up this kind of dialogue between us, I'm curious if any out of you have spoken with an occupational therapist throughout your cancer journey or have an idea of the role of the OT. I know that this is kind of a special service that isn't necessarily offered through all hospitals. You're much more likely to have interacted probably with a physical therapist throughout your journey. An occupational therapist, like I said, is part of the rehabilitation team, and our objective is really to look at activities and things that are meaningful to you that you might be having difficulty doing because of your cancer or because of your chemo or because of your treatment in general. So the role of the occupational therapist really is to look at what matters to you, what would you want to do or you have to do that's now challenging to do. And we try to work around that in terms of, are there physical changes that we can do? Can we strengthen a certain part of your body? Can we help reduce pain? Are there changes to the environment that we can make? Perhaps, a more comfortable way to sleep or get in and out of bed, or even looking more towards, the mental health or the psychological well-being and how that plays an impact in our ability and our desire to take part in the activities that we want to do. So that's a little briefing in occupational therapist. So I see Chris has written that he had some help with an occupational therapist who came into their home and helped them getting kind of back to walking and participating. So absolutely, there's a role of occupational therapy in the community, in the home, that you can have adaptations to your home environment that might make your space safer or easier to take your shower, etc. Today, what we're going to be working on is discussing kind of stress, relaxation, and stretching. I guess the fact that you're tuning in today means that you have some sort of interest in this area, and I'm excited to share what I know. And again, as we go through it, feel free to type in some comments or some questions in the box. I really like knowing that there's people on the other side. So Gabrielle, if you can just slip on to the next slide. Excellent. So the overview of today's presentation, I'd like you to leave having a better idea of what exactly stress is and its relation to the nervous system. I want you to feel like you have a couple of new relaxation techniques to go to, and also that you feel more empowered in terms of your ability to stretch and what is safe and what can I do and how can I be more physically active and move. So we can switch back to the presenter mode. Excellent. Yeah.
Bear with me for a second.
No stress, guys. So Sarah, just so you know, I see you wrote that you don't see the chat box. You guys are all doing fine. Just keep typing in the questions. We can communicate like that. Excellent. Hi, everyone. Super. Okay. So, here's a basic question. What is stress? It's something we talk about constantly. We all have stress in our lives. So stress can really be thought of in two parts. There's a stressful experience, a thought or an event, and then there's what we call the stress response. And so the stress response is mostly what we're going to be looking into. I think we all have a good idea of what stressful experiences are, whether it be waiting for scan results in your oncologist's office. It might be thinking about going back to work, or it might be thinking of, am I going to be able to travel? It might be so simple as opening up your credit card statement and feeling the pressure of, oof, things are getting tight. So one of the things being a cancer patient is that unfortunately all of the stresses of everyday life don't go away, but instead we have these new concerns on top of everything. So it even highlights the importance of understanding stress and managing it as best as we can. So the stress response is really something that happens in our nervous system. Our nervous system essentially, is our brain and our spinal column and the nerves running through our body. We have a conscious aspect of our nervous system. So when you say, I want to raise my hand, your brain thinks I want to raise my hand, and away you go. What also exists is an unconscious aspect of the nervous system. And so that's controlling biological activity that we don't necessarily have control over. For instance, our heartbeat, our blood pressure. There are things that we have partial control over. Sometimes we're aware of them. We can control when we swallow, but we can also swallow unconsciously. The same thing with blinking. And so this falls into the unconscious nervous system, also known as the autonomic nervous system. So the automatic nervous system, we can say. The autonomic nervous system itself is divided into two systems. So we have what's called the sympathetic nervous system. So just in the question, I'm just curious, do people know about the sympathetic nervous system? So the sympathetic nervous system, we can think of as a gas pedal. It's something that helps our body to react to a stressful or a threatening situation. So Nicole says she's aware, and I imagine a lot of you guys might have some idea of how this works. I hope for those of you who have a deep understanding that I'm not being too redundant, and for those of you who don't know, also, feel free to ask deeper questions if I'm not explaining enough. So in terms of the sympathetic nervous system, this is the reaction that revs up our body once we perceive a threat. Now that can involve, when we might be running late to catch a bus, so we're chasing the bus, or it could have been for our ancestors being chased by a lion, that the body reacts in a certain way in order to equip us for survival and success. So they often call the sympathetic nervous system the fight or flight system. This is probably beginning to sound a little bit familiar. So in terms of fight or flight, I'm just curious for you guys, when you're in a situation of stress, when you're feeling threatened or concerned or nervous, what are the physical symptoms that you're noticing in your body? So go ahead and type them in. Some of the examples might be, what happens to your heart rate when you're feeling anxious or stressed? So for most of us, our heart starts to pound. And another question might be in terms of your breath. How does your breath change when you're in a situation of high stress? If anybody has ever, found themselves breathing quite shallow, almost hyperventilating, absolutely. So we can have shortness of breath. Chris says sometimes there's a sensation of internal trembling, and Linda talks about muscle tightness. And all of these are an automatic response to a threatening situation. The thing that's really interesting is that our bodies are doing this from the basis of survival, in the sense that at one point, all of these, this sweating that Betty mentions, the heartbeat rising, the increased, tightness and muscle tension, all of these are adaptive strategies for our body in order to be able to survive a dangerous situation. In that case, we might have been running, like I said, from the lion, or maybe we're fighting the lion, and all of these, the way that the body has reorganized its resources, adapt us to have success in this situation. The thing that we know now is there are less real lions and a whole lot more, metaphorical lions in our life and our day-to-day. And the body doesn't necessarily distinguish between those. So the same reaction that you might have in a situation that's really dangerous to your life, can also manifest as the same physical reactions in a situation that you just perceive as threatening. And so, I understand, just that anticipation of having an oncologist's visit, or especially the anticipation of having scan results or blood work results, and what is it going to be, or what is my treatment going to be? All of this, your body certainly perceives in the exact same way as it would as though there were a lion chasing you. So even though you might not necessarily always be acutely aware that you're holding more muscular tension, or that your breath is more shallow, there can be an accumulation of heightened arousal or heightened level of stress that we kind of adapt to and say, hey, this is normal. The other part of the nervous system to counteract, so if the sympathetic system is the gas pedal pressing down, speeding up, we have something to counteract that, which is called the parasympathetic nervous system. And so the parasympathetic nervous system, they call rest and digest. Okay, so it's really the break. It says, hold on, slow down. Let's come back to a normal, relaxed equilibrium. So when the parasympathetic nervous system comes in, essentially it's counteracting all of these physical symptoms that we feel otherwise. So the sweating stops, the heartbeat calms, our breathing relaxes, and it allows for other processes in the body to be more successful. So for instance, you digest your lunch a whole lot better when you're in a calm, relaxed state than you do when you're wired up into a sympathetic nervous state reaction. Okay, does that make sense, guys? I'm going to take it as a yes. Excellent. So one of the things is that they're both necessary, that these, like I said, are adaptive responses that are inherent in our body, and they're physical responses that are meant to, to help us survive in the world. One of the things that happens is that the body has been cued to react very quickly to stressful situations, to throw us into this response of reactivity, of muscular tension, of being able to fight or flee. The parasympathetic system takes a lot more time to come. And it's our tendency that we don't always relax and return to that perfect state of equilibrium that might be the best for our mental health well-being as well as our physical well-being. So this is where the role of relaxation and consciously, developing relaxation strategies and practicing relaxation strategies can be beneficial to our overall health. So the impact of stress, and again, how do you experience your stress? So, I love this. Wendy here says, be as cool as you can to face piles of trials with smiles. That's nice. Definitely, chronic stress can lead to feelings of fatigue. And, in as a cancer patient, that fatigue is the number one problem frequently. Chronic, fatigue that is disproportionate to the amount of activity, or simply not having the energy that you would like to do the activities that you care about. So you take, cancer-related fatigue and you pile on a good dose of stress on top of that, you're really starting to be, counteracting something here. Of course, concentration. Has anybody experienced, kind of, sometimes we call it chemo brain. The technical term is cancer-related cognitive dysfunction. So this is like changes in your focus and your attention, feeling like you can't multitask necessarily. This is a reality, unfortunately, of cancer and cancer treatment, but certainly it's exacerbated by chronic stress. We all know, maybe if we reflect back when we were students, being at an exam, maybe you were underprepared for, and that feeling of anxiety raising certainly didn't help you to accomplish, focusing and remembering the correct experience. So Betty says she's definitely experiencing fog. And this chemo brain is something, or cancer brain is something that, is really commonly shared, and it can play a significant impact in well-being and quality of life. So again, although it is its own thing separately, one of the ways that we have some control is to mitigate, again, that level of stress. So when we're experiencing, forgetfulness or attention errors, how can we make sure that we're not activating our nervous system and kind of spiraling into this cycle of increased anxiety, which of course decreases our ability to remember that thing we'd wanted to in the first place. So again, in terms of fatigue, concentration, both working with relaxation principles can help to some degree manage those symptoms. Another common symptom, which is definitely impacting quality of life, can be pain. Again, when we're in a state of relaxation, we are able to manage our perception of the pain better than when we're in a high state of arousal or stress. Sleeplessness. Does anybody experience insomnia? I think, unfortunately, chemotherapy and insomnia, in my experience, go kind of hand in hand. Chronic stress, again, certainly doesn't help insomnia. And irritability is another thing. So, feeling frustrated in your relationships. So Nicole says, when she has her dexamethasone days, that there's, definitely there's definitely some difficulty sleeping on those steroid days, absolutely. Yeah, and Julie says also cortisone. Karun says good days, bad days of sleep. And so my hope also through, exploring some of these relaxation techniques is that they'll give you another tool. When we're talking about steroids, dexamethasone, cortisone, these things wire the body up, and it's very profound the way that it gives us energy and takes away sleep. So I'm not going to promise you that deep breathing is going to put you to sleep on a cortisone after cortisone injection necessarily, but that it can at least help you to come down to a state of relaxation where you're able to get some rest. So how do we cope with stress? Like, what is the best way to cope with stress? The number one way would be to remove the stressor, right? So if something is stressing us out, ideally, we would remove that from our life. Of course, this unfortunately tends not to be the most realistic situation. I'm sure we would all have, quite a few things that we would quite happily remove, but they're just facts of life. They're part of our reality, and we have to adapt our lives around them. So Gabrielle, I'm going to get you to pull up the next slide. So we're going to move in. Gary says his best way to deal with stress is to hide. So that's good. Yeah. So we're moving into kind of discussing some relaxation techniques. So we're going to go through some of the most profound ways that we can directly impact our nervous system. And then after that, we're going to talk about the stretching. And I just want to leave time, just so everybody's aware, we're going to leave like a good 15 minutes towards the end where we're going to do a practice. We're going to do a guided relaxation exercise together. All right. Okay. So in terms of relaxation strategies, so you can pull back to the screen there. Perfect. So, as we just discussed, that this stress response is happening really on a physical level. I think often we think about stress in terms of our brain and our thoughts and the thoughts that are going on, which is true. What's interesting as well is that we can think a stressful thought and we can activate that whole physiological response in our body in terms of, raising our heart rate and sweating and all of the rest, that our nervous system doesn't necessarily differentiate between what is a real threat, what is an imagined threat, and so on. So the reaction in the body, though, is what's fascinating in the sense that we're having a physical reaction. What that makes a really interesting circumstance is that gives us the opportunity to have a physical counter reaction. Okay, so one of the things that I always advocate for is that when we're thinking about calming ourselves down, whoops. Okay, when we're thinking about calming ourselves down, that we want to go from a physical standpoint. When you're having a strong stress reaction, and let's think about, those times where, you might be anticipating a scan, or you're feeling claustrophobic, or you're, really dislike needles and you have a chemo appointment, that this can really generate a very strong physical response. So we really want to go through the physical body in order to calm ourselves down. One of the best ways that I find for immediately calming myself down in a stressful situation is through activating muscle tension. So one of the things that we discussed is when we have this when we have this gas pedal experience of our body reacting to stress, one of the things that happens is that we tend to get tense. And so the body is actually diverting its blood into the muscles to prepare ourselves for battle. But the thing is, we don't actually have anything to fight. So we end up with muscular tension and discomfort. And there's a feedback loop that's happening in the body, that as the body is holding itself tense, then the body is understanding, hey, this is a dangerous situation. Better be on the lookout for perceived threats. And it reinforces. So one of the ways we can break this cycle is by making a conscious choice to relax the muscles. In a situation of high stress, I advocate for something that I call a quick relax. And so I'm encouraging you all to do it with me. And all it is is I want you to squeeze your fists as strong as you can and then relax. And really when you relax, let it shake. And the same thing, squeeze your shoulders if it's comfortable and relax. You can squeeze your buttocks and relax, and squeeze your toes and relax. The thing that's interesting about this is it's a lot more effective to squeeze and relax than if I just said, hey, relax your shoulders, Sarah, relax your shoulders, Julie. But by squeezing first and relaxing, we get a more profound relaxation, okay? So the quick relax is helpful in an immediate situation where you find yourself overwhelmed with a stressful situation. And to be totally honest, I get a little bit nervous in public speaking, and I found myself, as Gabrielle was introducing, I was going through my squeezes to bring a sense of relaxation and immediate calm into my body. So the way we access our parasympathetic nervous system, our calming system, is again, like I said, through the body. So through consciously relaxing muscle tension, number one. The second is the impact of breath, okay? I'm gonna ask, again, you guys, just to tell me when you're feeling anxious, what, like, where are you breathing? Where do you feel it in your body? And a lot of, people experience that their breath becomes short and tight and fast. And you can think about, somebody having a panic attack. Janet says that she finds herself holding her breath. Absolutely. So these incomplete breaths. Chris feels it in his chest. And you think about, when somebody's having a crisis, they really start to breathe quite rapidly like this. Again, the fascinating thing is that if I sit here and start breathing like that, in about 5 minutes, my body's going to catch on and say, wait a minute, something's wrong. I'm not safe. And it's going to start the whole chain of stress response simply because I started breathing. What's fascinating about that means that we have the opposite way of entering our body and slowing things down, that by consciously altering our breath in a manner that slows things down, that cues our parasympathetic nervous system, our rest and digest nervous system, things are okay, I am safe. So by doing slow, elongated, deep abdominal breathing, we are telling our body in a physical way that really goes beyond our thoughts, my situation is safe, I am safe, I can relax. I find this fascinating because I think one of the things that we often think, we get trapped in our heads. We think that the stress is all happening up here and that probably we should have the power to intervene up here. If only I stop thinking about that problem, if only I can calm myself down, if only I stop being so nervous. But unfortunately, we don't have a lot of control over our thoughts when our whole body is in a stress response. So again, pulling it down into a physical reaction, we can enter the stress through the body and calm the nervous system, which gives us a much better chance to begin to slow down in the mind as well. So Casey talks about feeling the anxiety and the breath really concentrated in collarbones and upper chest, and absolutely. And Sarah says, I have to talk myself into taking deeper breaths. And that is a really strong technique, Sarah, is that by taking deeper breaths, believe it or not, we are stimulating our nervous system in a way that convinces us we are not in a threatening situation. So if it's interesting to you, you can do a bit of research on something. It's called the vagus nerve. It's essentially a nerve that runs through our chest down into our abdomen. And as we breathe, the diaphragm, so the separation between the internal organs and the lungs, massages the vagus nerve. So with each deep inhalation, where we're really pulling our breath as deep into the lungs as we can, we're getting a massage of the vagus nerve, which cues back into the parasympathetic nervous system, telling ourselves to calm down. So Chris is asking, once we have anxiety, does it ever go away? Is it something you learn to deal with the techniques that we're talking about? So, it's a good question, Chris. There's definitely a degree of anxiety that, would be considered, something more in the realms of psychology or psychiatry, like a diagnosed with general anxiety disorder. the techniques that we are using are appropriate in that circumstance, or they're appropriate in, basically for everyone. Everyone's nervous system works in the same principle. It works in the same way. There can be a degree of anxiety that, we could advocate requires, more intervention than necessarily the tools that we're discussing today. And certainly if you find that your anxiety level is influencing, your ability to do basic things, to get up, to interact, to leave the house, like that it's stopping you from living your life to the degree that you would want to, I would advocate, speaking with a psychologist if you have access, if there's some psychosocial, perhaps a social worker through your community. These can be kind of good tools for gaining those extra levels. At the same time, absolutely the techniques that we're talking about in terms of working with muscle tension, working with the breath, this is going to lower your anxiety by calming your nervous system down. So we've spoken about two physical ways that we can begin to calm our nervous system. So first and foremost, through muscular tension, through a quick squeeze and relax, automatically drops the muscular tension, telling our body, hey, things are going okay for me. And the same thing now with the breath. One of the things that I've found really helpful when I'm really keyed up, I've noticed that I can say, okay, Kyla, slow down, take a deep breath. But that can actually make me become more aware that I'm not breathing deeply. And suddenly I can say, oh my gosh, I'm actually not breathing deeply. And it can actually cause me to feel more anxious. Again, this is where I pull back into the quick relax, so a squeeze and relax. And the other technique that I've found really helpful can be a breath where there's actually a hold as well. So if you're experiencing any sort of breathlessness or you feel like you don't have a good lung capacity, you adjust this based on your comfort level. Never hold your breath past something that makes you feel uncomfortable. That's going to just ramp up your feelings of stress even further. But what I like to do would be to inhale for a count of, let's say, 1, 2, 3. I hold for 1, 2, 3, 4, and I exhale 1, 2, 3, 4, 5. So again, inhaling 1, 2, 3, hold 2, 3, 4, exhale 1, 2, 3, 4, 5. Now, what this forces us to do is we are exhaling so long that when we inhale, we're actually pulling in a deeper breath to be able to fulfill this sequence. So in times of really feeling like the need for a strong tool, I find that this breath retention sequence can be helpful. So again, like I said, the numbers can vary. It's inhaling for a short period, holding for a moderate period, and exhaling for the longest spell. So those are like physical ways of adjusting our stress response, which, I believe strongly in these tools. The last thing, there is a role for our thoughts. Like I said, we tend to be most successful when we address our stress response through the physical body, as that's where it's often happening. And once the physical body is calmed, it helps us to be able to enter into our thoughts and calm racing thoughts or ruminations. So after going through, a muscular tension and relaxation exercise, some deep breaths, 3 deep breaths, 4 deep breaths, then we can begin to pull into our thoughts. And one of the ways that we want to kind of control the anxiety spiral or the stress spiral within our thinking is to pull ourselves out of, what's called rumination or repetitive thoughts, or kind of this snowball of negative things that we can often start building up in our mind. One of the ways that can be quite effective of pulling out of the cycle of catastrophizing or of rumination can be by practicing what's called mindfulness. Again, I know that these are terms that are thrown around really frequently in pop culture and can sometimes lose some of their power, but I'd encourage you to just keep it very simple, in the sense that when we're thinking about mindfulness, all it really means is pulling our attention into the present moment. Why this helps in terms of a stress response is that while our brains are cycling through negative ruminations or fearful thoughts or catastrophization, we're just feeding back into our body the idea that we are unsafe, which triggers our body into believing that the sympathetic nervous system should be activated, and it creates the cycle back and back and back. By becoming mindful in the moment, essentially we're pulling our attention away from these thoughts and placing it in the present moment. A simple exercise for mindfulness when you're looking to calm yourself in the moment can be simply by observing around you and naming different things that you see. So I'm looking outside my window and I'm seeing the wires blow. I see a blue sky and clouds. I see my chair. I see a towel. I see the door. And simply by really narrating and dictating to yourself what you're seeing basically takes up the cognitive space that you were previously using to be worried. So you can do it through a visual sense, naming objects that you see. One of my preferred ways is to do mindfulness in a physical sense of how your body feels. So right now you can think of, where is my body in contact with the chair or the seat that I'm in? Is it the backs of my thighs that I can feel? Can I feel my back or my arms resting on something? And again, this is pulling our attention away from negative ruminations or stressful thoughts into the present moment, which allows the nervous system to drop down. Okay. One of the things before we move on to stretching, I just want to get back to breath. So we spoke about the pausing, like the inhaling and holding the breath and a longer exhale. So this is a good way to start slowing down your breath. The second and kind of the most important breath is probably well known to you all as well. It's called the diaphragmatic breath or abdominal breathing. And what abdominal breathing is essentially, like we said, as opposed to having the hyperventilating anxious breath, we're going to have a smooth, deep, profound, restorative breath. This is sometimes, really unnatural to us. Sometimes we have learned to kind of breathe shallowly in our chest for quite some time, or, I think often there's pressure that you keep your stomach pulled in a little bit. So this idea of really expanding your stomach and letting your belly button press out can feel a little uncomfortable at the start. And oddly enough, it takes practice to learn to breathe properly. So the practice really is, it's easiest if you're laying down. You can also do it in seated, but essentially you're going to just take your hand and place it on your abdomen, on your navel. And as we're breathing here, as you inhale, I just want you to notice what's happening with your hand. Is it moving? Is it stationary? And if it's not moving, what I want you to do is see if you can inhale so deeply that your hand actually pushes out, that your belly expands. And as you exhale, it contracts back in. Has anybody had the experience when they're doing this exercise that as they inhale, their hand is actually sinking in towards their spine? And as they exhale, their stomach is relaxing? It's not guaranteed that you have, but this comes up from time to time. And it's a type of reverse breathing, that pattern that sometimes we can establish. So Nicole's having this. Okay, so Nicole, I want you to especially to really focus on working on your abdominal breathing. If anyone's ever, and I'm sure it's happened, either you've had a fender bender or come really close, and what is our reaction? We go, and we inhale and we suck in our fear. And so as we're inhaling, we're contracting. And finally, when we relax, we let it go. This pattern of inhaling and contracting is again impacting the nervous system in a really interesting way, because this is a stress reaction. This is a fear reaction to inhale and to clench, and exhale and relax, which is really interesting. So if you're finding as you inhale that you're contracting your abdomen, and as you exhale that it's allowing the muscles to relax, I want you to see and take some practice, and it's going to take some work because it's going to feel unnatural, Can you switch that? Can you imagine that your abdomen is like a balloon, and that as you inhale your lungs, that it's filling up this balloon and expanding out, and as you exhale, the air leaves the balloon, it leaves the lungs, and it collapses back down. And so practice that. Everyone, I really want to say it's such a simple thing, and it's probably the strongest tool that we have in order to regulate our stress response. The beautiful thing about it is that it can be carried with us wherever we go. You can do your abdominal breathing, you know, in a stressful situation, whether you're in your car or in, you know, discussing with family, whatever it is, in the doctor's office, that this is a way that you have access to your body and your stress response in a very direct sense. Does anybody have any questions about the muscle tension, the breathing, the mindfulness before we go on to stretching? And thank you, Chris. Chris gave me a bit of positive feedback. He said that these are great ideas. I appreciate it. Okay, guys, so if there aren't any questions, we're gonna just slip to the next slide. Gabrielle, I don't know if you're still here with me to help me do that.
Yes, I am.
Thank you. Okay. Great, so we're just gonna move on to relaxation techniques and we'll keep going one more. Okay, so stretching safely is the title of the next slide. And the reason that I put the word safely there is because I know, there's a lot of concern with myeloma in terms of bone health, bone stability, bone fragility, and how does movement and exercise and stretching impact those bones. And so we're going to get into that absolutely today. So, Chris, I guess we can flip back if you're ready to go back to the presenter mode. Thank you. Excellent. So, again, chat in the question box there. Go ahead and tell me, the benefits of movement, benefits of stretching. So definitely, excuse me, guys. The benefits of stretching, anytime we're moving the body, it's helpful for our circulatory system. It's helpful for our heart. It's helpful for the muscles. It's also helpful to the lymphatic system. So the lymphatic system is part of our immune system. There's fluid that runs throughout our body. So stretching can increase blood flow. It can increase the lymphatic flow. It also, if we're in standing, we can have an impact on weight-bearing exercise, so that can be beneficial towards our bones. There's obviously, a lot of benefit for exercise, for stretching, for movement. And Wendy says relaxing. And of course, it's good to move because it helps, again, calm down our body. Something that I think about often is that if our bodies were programmed to have a physical response to threat, if they were programmed that when we felt stress that we were to fight or to run like hell, it makes sense that there should be really a physical reaction to stress as well. And sometimes, we've talked about the tension and the breath, but sometimes I really feel like it can be through movement as well, that we have the need after or to process a physical stress, or to process a stress is through a physical reaction. And again, stretching and movement and walking and exercise, these can all be great ways for kind of digesting the stress. So the big thing is, and I'm sure you hear it time and time again, your situation is going to be unique to you. And it's important that you speak with your oncologist and quite precisely to know, what are the limitations that I might want to think about. Where am I vulnerable? Do I have any fractures? Am I at risk of fracturing? To really know from your doctor's standpoint what your safety is in certain activities. And I'd encourage you all to really ask precise details and even ask your oncologist to draw things out for you. you know, on a picture of a body so that you know for yourself what is safe and where you have to be careful. Because certainly, you know, even those with really compromised bones, with the right guidance and with the right, you know, with the right care, there are safe movements and beneficial movements. So I hope that in the centers that you guys are living in, that you have access to you know, some advice that people can guide you, whether it be if there's an oncology physiotherapist or an occupational therapist, or if not, you know, speaking with your medical team, your doctor, your nurse, to ask specifically what are the activities that are good for me and what should I avoid. In general, you know, anytime there's this question of bone safety, bone health, we want to avoid what's called extreme positions of the spine, essentially. And again, this might be old news to you, but what are extreme positions of the spine? So we're talking about flexion. So flexion is, if this was my spine, flexion is bending forward, okay? Or extension, I have a harder time doing that, but extending up. The other thing that we have to be mindful, and you know, it's true for absolutely everyone, is extreme twisting. So twisting along the vertebral axis can be dangerous. On top of that, twisting and lifting. So anytime that you're turning the spine and picking up a weight, this is a guarantee for problems for absolutely everyone. Okay, so you can think you've probably pulled your back before unloading something from the car, shoveling snow. These are all positions where we're using the twist and the lift. So I think just for general principle for back health for everyone, avoid extreme torsion, so extreme twisting, and never, ever, ever twist and then apply, like lifting a weight at the end. So bone health, avoiding extreme flexion, extension, and twists. There are absolutely a way to continue to be mobile and stretch the body and move despite having those kind of restrictions on our limitation, or on our physical bodies. Some great ideas, you know, Tai Chi. Tai Chi is an excellent movement and involves stretching and gentle movement. So for those of you that don't know, Tai Chi is like a slow motion martial arts, and it's been well researched to show, you know, great health outcomes, specifically balance, stretching. Everything is, you know, it can be in seated, but in general, it's in standing. So anytime that you're doing a standing exercise, it's what's called weight bearing. So you're using the effect of gravity through your skeletal system, and that actually encourages bone health and bone growth, bone density. So it's absolutely excellent. So check out Tai Chi. Tai Chi is very low risk. There's no sudden jarring movement. So even if, you know, you have some compromised bone health, that this is definitely an avenue that you can explore gently and slowly without concern. The big one is yoga. I think that yoga is often really promoted as this fantastic exercise for everyone, but definitely at the same time, we have an image in our head of these yogis who are twisting themselves into pretzels, which this is the definition of also extreme spinal flexion, torsion, etc., the things that I told you to avoid. That's not to say that yoga is not appropriate for people with multiple myeloma, not at all. I think the thing is really finding the right yoga session, the right yoga teacher, and knowing your own body and where you might have vulnerabilities, and having really clear communication. So just as a resource, there's a book called Yoga for Better Bones. That can be an interesting one that kind of, it's designed for people with severe osteoporosis. So it's really thought of in mind of bone fragility and bone health. That can be excellent. There's also Yoga for Cancer. So the website is y4c.com. Those are both interesting avenues to explore. Like I said, always knowing your body, always discussing with your oncologist prior to starting these things. But yoga is possible. It's just adapting it in a way that's going to be safe for your spine. So bringing it all together, guys, we're imagine that we're already 10 minutes. So Wendy says she uses a sitting elliptical cycling machine, and that's excellent, Wendy, that you have the chance to get some cardiovascular exercise in a stable position. Excellent. So guys, I'm gonna just leave a moment here if there's any questions, because I'd like to go into kind of a guided relaxation, kind of basically going through some of the things that we spoke about before. Gabrielle, do I have an extra 5 minutes if we run over, or is this?
Absolutely. No,
Yeah,
we can go a little bit over. Yes. No
super.
problem.
Okay. So if everyone's, yes, questions. Karen, thank you. What are your thoughts about going to physio during COVID? Okay, great question. In our province, currently, we don't, the rehabilitation services aren't open. So it's a tough one. I think, you know, depending on your immune status, are you in active treatment? What is the situation in your own province in terms of the risk is going to dictate how safe that is. I think, you know, in my situation in Montreal, for instance, I would advocate that, you know, people do things via Zoom or at a distance for the time being. But like I said, it's going to be kind of depending where you are and where your immune system's at and so on and so forth. Any other questions before? Yeah, we do. Okay. So again, I originally had some 6 vertebral fractures and still have some stiffness and that, okay, BC that it's open. Betty says it's not, Corinne says it is, so who knows? You know, it's really a personal judgment in terms of if you feel comfortable with it, guys. I'm sorry, I can't really make that call. All right. So if there aren't any other questions here, we're going to go on. We're going to do a guided relaxation. So it's going to be about 10 to 15 minutes. If you have time, please stick around. If not, it was a pleasure meeting you. And I'm going to ask Gabrielle if you just pull to that last slide, the pulling it all together slide. We'll just stay on this slide. So everyone, I would encourage you just to find a comfortable position so that ideally, if it's in your setup, if you can lay down on a bed or on the couch, that would be amazing. If you have a recliner, you can lay back in your recliner. If that's not available to you and you're sitting in a chair, no problem. In that case, I'd just ask you to find a comfortable position in the chair. So bringing your feet flat on the ground and resting your hands on your lap. And I'm going to encourage you. I can't see anyone and I don't think you guys can see me. So let's all close our eyes if you feel comfortable. And we're going to do, like I said, a guided relaxation using some of the principles that we discussed earlier in terms of muscle tension, breath, and mindfulness in order to calm our nervous system and feel the positive effects of some balance. So with our eyes closed, we're going to start with the breath with the pause that I spoke about. And again, please do this at your own time with your own rhythm so that you're not straining or causing any discomfort for yourself. But I'd encourage you to inhale 1, 2, hold your breath 2, 3, 4, and exhale 1, 2, 3, 4, 5. Repeating, inhale for a count of 1, 2, hold 2, 3, 4, and exhale 2, 3, 4, 5. Inhaling 1, 2, hold 2, 3, 4. Exhale 2, 3, 4, 5. Excellent. And so just let your breath return to normal. There's no effort. And from here, I want you to bring your attention down into your feet. What I want you to do is squeeze your toes and tense up your feet and squeeze, 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 and relax. Now I want you, if it's comfortable, always, and not forcing, but just squeeze your right leg as tense as it can be and relax. So let's move to the left leg, squeezing the muscles in your calf and your thigh and relax. Now I want you to squeeze your buttocks, tense and relax. Now I want you to gently press your lower spine, so the lower back, into the surface behind you. So you're tensing your abdominal muscles to squeeze. And again, relax. Let it relax completely. We'll move on to the shoulders. We can lift up our shoulders and squeeze and relax. Maybe we'll do that one a second time because there's a lot of tension there. Squeezing the shoulders and relax. Good. Let's move over to the left hand. You can take your hand and make it into a fist. You can raise up your arm and squeeze the whole arm, and then relax, let it drop. The opposite side, let's squeeze the hand into a fist, squeeze the arm tight, tense, and relax. Really let it flop. Relax. Good. Now here's my favorite one. We're going to squeeze our face into a small, ugly face. So like you've eaten a lemon, squeeze it tight, 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 and relax your face muscles. Excellent. So we're just going to pause here for a moment, continue breathing, and feel. Sometimes there's a sensation of tingling, relaxation that we can feel after going through muscle relaxation exercise. Good. And from here, we're going to change our focus now slowly onto the breath. And so before we'd spoken about a balloon. So I want you again to envision a balloon. So choose a balloon of your favorite color. I want you to visualize this balloon residing underneath your navel in your abdomen. And as you inhale, I want you to feel the air expanding, filling this balloon. Big, round, beautiful balloon. Exhale, the balloon deflates and the air rushes out, relaxing the abdomen completely. I keep going, inhaling smoothly, fully, blowing up the balloon, expanding the abdomen, not forcing, gentle. Exhale, letting it all go. The balloon collapses. Inhaling slowly, completely. And exhaling deeply, fully. Again, deep inhalation, expansion. And exhalation, contraction. And knowing that each time we inhale deeply, we're massaging our nervous system. And each exhale, we're letting go of tension. And that stress is leaving our body as we exhale. Inhaling, filling our abdomen, this beautiful balloon with well-being, with breath. And exhaling, letting go of tension. Inhaling, continue, expand. And exhale, slowly relax. Now from this point, let's move our attention into the sensations of our body. And keeping your eyes closed, begin to bring your full attention down into your feet, recognizing the place that your feet contact the floor. And by recognizing this contact with the floor, you can begin to feel a sense of heaviness, of support, of release. Bring your attention up into your legs, and again, checking for the points of contact. Where do your legs touch the bed, the floor, the chair? Filling that space of contact with your full attention, feeling the weight of your body and the support of the surface. moving into your hips, your buttocks, your lower back. Again, being incredibly mindful, being aware of the sensation of your body in contact with the chair or with the bed, and the weight and the relaxation of that contact. Bringing your attention higher up into your back as you feel the point of contact of your back and its supporting surface. Bring your attention down through the tops of your forearms. Feel their weight as they hang from your shoulder joints down into your elbows. Feel the tension release. And bring your attention now into your hands. And our hands are full of nerve endings, very, very aware of the world. Bring extra attention now by putting your focus into the points of contact where your fingers and your hands touch your lap or touch the surface next to you. And now try to expand your attention and your sensation to a global feeling of awareness in your entire body. Bring awareness from the top of your head all the way traveling down to your feet. We're going to take a few deep breaths here, slowly inhaling and exhaling. And each breath will encourage you to inhale a little bit deeper and exhale a little bit more completely. And slowly, slowly, with the next inhalation, I want you to begin to wiggle your fingers, wiggle your toes. Just begin to wake up your body. You can keep your eyes closed if it's comfortable. And you can expand that movement. You can begin to roll through your ankles and your wrists. And if it feels nice to you, you can reach your arms up. You can stretch in a way that feels good. And then we can open our eyes and welcome back. I'd encourage you just before we go, just to share in the question box there how that guided relaxation felt for you. I know when I go through it, I find myself feeling a little bit more connected and a little bit more aware of my body than I was prior to the exercise. Thank you, Craig. Craig says that was useful. And so, Craig, if you liked that, and Claudia, thank you. She knows Yoga Nidra, and that's also what we just did in yoga. This is called a Yoga Nidra, a yoga sleep. And so, if you're interested in these techniques and there are things that you feel helpful, thank you, Janet and Denise and Gary and Wendy, guys. Thank you so much. I'd encourage you all to pursue it, and the internet is absolutely full of resources. Some search words that you can look for are progressive muscle relaxation can be one. We have, like was referenced before, Yoga Nidra. Loretta says she feels like a rag doll. Thank you. Thanks, Sarah. Thank you, Sheila. So Yoga Nidra, you can look up progressive muscle relaxation. You can look up guided relaxation. I think the thing is always finding kind of a voice or, somebody that you connect with, or you like the music and you find it calming. So just do some exploration. Just before we get going, I have a question from Wendy that's interesting. Are there any exercises for neuropathy? It's a great question, Wendy. Neuropathy obviously is something that is a big frustration for a lot of people. And unfortunately, it's one of those things that, in oncology, we have medication. You might be prescribed Lyrica or something like this in order to cope with your neuropathy. In terms of what can be done for improving neuropathy, I'm constantly looking for solutions. I can't say I have anything brilliant. I I do know from kind of my experience working with people that the more you can encourage healthy circulation to the part of that body that you're experiencing your neuropathy, the more likelihood of that healing, that regeneration taking place. And so, you know, if it's in your feet, really wiggling your toes and doing ankle rolls and so on and so forth is definitely beneficial. Some people are interested in exploring acupuncture. I can't say one way or the other, but I know that is an area that there is some research going into. But exercise for neuropathy, I think it's really exercise for your whole body to encourage healthy circulation and allowing the body to heal in the best way it can. Aquafit. Okay, thank you, Janet. So Janet is another participant here, and she said that Aquafit helps. Absolutely. And I like Aquafit as well in the sense that it's a low impact exercise. So you can get a lot of resistance, a lot of movement from the water without that heavy pounding like you would if you were, say, jogging or doing other types of exercise. Guys, I have to say, even though I couldn't see you, it's so lovely seeing your names and knowing that we all got to connect from across the country. So I really appreciate, you know, you tuning in. I hope that you found it helpful. If you have further questions, I don't know, Gabrielle, maybe you can connect us, but thanks everyone for your time, and I hope that you all have a fantastic afternoon.
Thank you, Kyla. That was an excellent presentation. I can say that I definitely feel relaxed after all that. I think I really needed that. So thank you on behalf of everyone for doing that. And I see all the really nice comments coming in, and they're well warranted. So just before we end off, I just want to remind everybody of our next webinar, Wednesday, May 20th at 4 p.m. The role of a drug access navigator and access to medications during the COVID-19 pandemic. So thanks again, Kyla. I wish you a wonderful afternoon and evening.